The CDC will, at the moment, not be able to move forward with its proposed changes to the childhood vaccine schedule after a federal judge temporarily blocked the recommendations. The judge's ruling is in response to a lawsuit that asked the court to take a look at Health Secretary Robert F. Kennedy Jr.'s revamping of the Advisory Committee on Immunization Practices. Kennedy fired the entire 17-member panel last year and subsequently filled the empty posts with several anti-vaccine members. The changes Kennedy wants to implement would end recommendations that children be vaccinated against the flu, meningitis, hepatitis A and B, and more. Let's bring in MS Now senior medical analyst Dr. Vin Gupta. So, Dr. Gupta, you have warned for quite some time about some of the changes that Kennedy wanted to do to the vaccine schedule. So give us your reaction to this.
That's good news. I mean, Jonathan, unfortunately, we have to get the courts involved in what should be a transparent process on the facts and on the science. That's what you and I have been talking about now for over a year. So it's in some ways tragic that this is what is required, but it's good news that there's statutory law in place and that there was this injunction. And so hopefully we'll have a pause here. Question is, what is the administration going to do? They're highly unpredictable. We don't know what they're going to do. This ACIP meeting, the Vaccine Advisory Committee meeting, has been delayed. But really, for the American people, this signals that processes matter, transparent processes where everything scientifically is debated, there's accountability. Because at the end of the day, Jonathan, we're talking about children. We're talking about preventable illness and keeping kids out of the hospital. That's what the rotavirus vaccine does. That's what the hepatitis B vaccine does. And that, I think, has been lost in this kerfuffle in this conversation.
There have been several pieces of the Kennedy agenda that have now been blocked. Where do you think he goes next? What other priorities might he tackle?
Well, I think we're seeing it now in his messaging. It's clear that Chris Klomp now is the number two. They're moving away from controversial vaccine messaging, focusing now more on ultra-processed foods and nutrition messaging, which, as far as I can tell, they're not doing anything novel there. They're not doing anything new when it comes to actually promoting policies, Jonathan, that will allow young kids to have healthy meals, because we're cutting SNAP. 24 million Americans no longer have access to affordable health care insurance. So they're marketing a lot. They're great media manipulators. But when it comes to actual policy for healthy nutrition, healthy meals in schools, the rubber just doesn't meet the road here. There's a huge gap between marketing and substance.
In 30 seconds, what's the latest on some of the measles outbreaks that have been so worrisome across the country?
Well, we're seeing epidemics now in schools. And that's the concern here, is once we detect it, Jonathan, we probably have tons of undiagnosed cases because not everybody gets tested. A lot of people are vaccinated. They don't realize they're positive, maybe not symptomatic. And so I think this is a canary in the coal mine. Schools in particular, we're going to have spring break, travel. So it's likely, again, going to get worse before it gets better.
All right. We always appreciate your insight. MS Now senior medical analyst, Dr. Vin Gupta. Dr. Gupta, thank you again.